please do be aware that any questions you ask will be recorded for posterity. So when you're working with subsections of the questions, it's really important to make sure that you read into the text very clearly. I realize that this can sound like a simple thing, but we found that in the past that some of our candidates can sometimes fail to pick up marks simply because they've missed small parts of the question. I'd like to pull up a specific example. However, I'm having a real problem with my internet on this end, which is slowing down my access of this piece. One second, my sincere apologies. Right, okay, there we go. Fantastic. Okay, I'm going to talk about question 1A as the first question of the piece, and I'm going to discuss how this concept of subsections applies particularly strongly here. Talking about analyzing the role of beneficence, non-maleficence, autonomy, and justice in regards to aesthetic treatment. Now, I realize that this is a relatively straightforward question in terms of its structure. It's asking you to discuss 4 key elements. And as such, it's important that you divide your answer in an ideal world to mirror that structure, rather than discussing in a single long piece of prose the nature of all of these elements. It's really important to break them down into their subsets. And the marking of the question reflects this, with a division of the 10 marks that are available for each SAQ being found between the 4 points. So what you really want to do ideally here is, I would argue that you should make 3 to 4 mark scoring points in each of beneficence, non-maleficence, autonomy, and justice. Because each answer is scored out of 10, by dividing your work into these 4 subparts, and by approaching mark scoring points for them in a numerical perspective, whereby you a question of 10 marks into 4 parts, so you should approach 3, or you should be looking to approach 3 or 4 marks to sort of round out and make sure that you're making your minimum 10. You can really safeguard yourself from these failings. Another question that I'd like to discuss, which has issues with this subsection concern, is 2D. So 2D is talking about facial morphology in relation to aging. So when the question asks you to describe the bone, muscle, and fat changes, it is not asking for a generic description of facial anatomy in regards to aging. It's asking you to focus very specifically on those subsets. So when it says bone, muscle, and fat changes, again, divide your question into 3 distinct points and talk about bone changes. So you can talk about broad topics such as the expansion of the bony orbit. You've got a wide variety of points that you can fall on based on your e-learning, but you make sure that you don't have an answer that is heavily charged for points on muscles and lacks detail when it comes to fat pads or to bone. So you've really got to make sure that whenever you're reading a question, and when we go into some of the problem questions later, this will become really apparent, you've got to make sure that you're hitting all of those points. Now, in regards to the style of your SAQs, there are a lot of styles that you can approach in your writing. However, there are some concepts that I believe carry across no matter what style you're approaching your SAQ that will allow you to maximize your marks. And I've talked about mark scoring points and your writing style in the SAQ guidance document that I've provided you with, but it can confuse some people, so I think it's worth explaining broadly. Now, the first point I'm going to draw attention to here is clarity. When you're answering your SAQs, it is really important in relation to those subsections that we discussed to remain clear with your mark scoring. For instance, when you are discussing, there is a question which relates to youth and attractiveness in relation to various parts of the face. This is question 2E. Apologies, by the way, I'm still having problems with my internet, which is making it slow to move through this document. On question 2E, it asks you to assess facial shape, facial proportions, facial symmetry, eyebrow shape, wrinkles, and facial contours, all in relation to youth and attractiveness. As such, you might be tempted to make the generic comment that facial attractiveness and youth can be affected by cultural factors, with people from different cultures ascribing different qualities to the appearance of a youthful face. Similarly, you might talk about another important part of this question, which is gender dependence. You might talk about how in women, high-arched eyebrows are associated with youth and attractiveness, whereas for men, usually thicker, straighter eyebrows have this quality. when you are talking about gender dependence, as I just gave an example, you want to keep it focused and explicit. So if you're going to mention culture dependence, if you're going to mention gender dependence, both of those are excellent, but you must be explicit in which part of the question you are referring to. So there, when I described the gender traits of eyebrow shape in relation to youth and attractiveness, I talked about gender dependence specifically in relation to youth and attractiveness. I didn't simply talk about general facial concepts in relation to youth and attractiveness as regards female or male people, regardless of whether you're assessing a male or a female face. If you were to make general points, for instance, if you were to say male faces and female faces are viewed differently by viewers in different cultures, which can affect their appearance, that can affect perception of their appearance greatly, you would struggle to score marks because you are not being explicit with, you are not showing explicit clarity in answering the question. You're answering generally. So whenever you see a question broad parts like this, make sure that you score your marking criteria for each of them. So this can bring up the question of repetition. You might say, well, I don't want to talk about culture dependence or gender dependence for all of these points, for facial shape, for facial proportions, facial symmetry. But in fact, that repetition is appropriate in SAQs. In an essay, in a longer form essay, you can attract you can find yourself losing marks for repeating over the same point repeatedly. But in your SAQs, that clarity is really important. It allows you to score marks across all of the subsets. So to recap, you should practice explicit clarity in order to score your marks confidently, because if you are simply generic with your points, then you will struggle to ascribe the mark scoring points that you make to subsections of the question. Beyond that, you should also be aware of the fact that simple facts and self-evident information matter very deeply. Now, something that I want to draw your attention to is question 2G, which talks about what must be in place for an aesthetic medical premises to perform treatments, and also asks you to explain the use of the routine audit of clinical outcomes. Now, this question, first off, I will talk about subsections again. It's clearly divided. When you read that question, what it's asking you to do is, A, explain the premises requirements for aesthetic medical procedures to take place, which should be the first half of your question, and B, explain the use of routine audit of clinical outcomes, the second half of your question. This is a divided two-part question, and you need to give equal attention to both. Your 10 marks here are going to be divided 5 and 5. You need to give equal attention to both and make sure that you're covering all elements of the question. However, back to my central point here, which is that simple facts and self-evident information matter. In the first subsection of this question, talking about premises requirements, we get a lot of people confused by this question, thinking, what do you mean by premises requirements? I haven't learnt any of this. However, what you're missing, if that's the sort of confusion that grips you when you view this question for the first time, what you're missing is the fact that this is really asking you to show core, simple knowledge. The second part of the question, when it talks about the routine audit of clinical outcomes, will require you to be more intelligent with your answer, but initially you're simply going to want to stick to the simple stuff with aesthetic medical premises requirements. For example, you're looking for 5 marks here, and some valid points that would score marks would be, the clinic must be safe and secure. That's a perfectly valid mark scoring point. The clinic must be prepared in a sterile way. Treatment spaces must be sterile environments for the most part. Sterile equipment must be utilized. That would be another mark. Your clinic must be properly equipped. You must have hyaluronidase on stock. You must have all appropriate medical supplies for dealing with needle stick injuries. Again, a mark, very simple. You must have suitable staff with appropriate training in all aspects of your business. Again, simple but important. You could also note that you need to have proper insurance in place and be compliant with insurance regulation. Again, these things are so simple that people often miss them, but they are all mark scoring points. And whenever you're approaching a question, especially if the question asks you to explain or describe something, look at your explanation or your description and ask yourself, have I covered the really basic things here? We'll return to this later when we talk about the question that asks you to compare dynamic and static wrinkles, which is one of the hardest questions in the SAQs to pass, despite the fact that it seems very simple. To sum up the writing style points that you should approach, you want to be rich on content and light on analysis. You want to make sure that you've got those mark scoring components in. You don't want to be making a single point. For instance, a clinic must be safe and secure, and it must be a safe, secure environment within which your patients can receive medical procedures. That would be great, rich content. To then say examples of ensuring security in premises would be making sure that you have proper construction in the building, having security staff where necessary. Once you start getting off into that, you're going into deeper analysis, and you can't rescore marks by analyzing points in greater depth in general within the SAQs. So you really want to keep rich on content, lots of points, but light on analysis. So I'm going to move on to the next slide here, which is talking about the third key element of your SAQs, which is your length. You have an ascribed word count for each question. You must decide on a division of that word count. To simply approach the question as one block and end up spending 10 times as many words as you do on the first half of the question as to the second half will see you falling foul of the subsection system. So make sure you make a conscious effort to divide your word count. You also need to count your mark scoring points. When you run through a question, so I'm going to pull up an example here, and again, you'll have to bear with me while there's a horrible delay. Apologies. 1 second here. Okay, so here's a perfect example. Question 4E, which is the appraisal of basic skincare products and cosmeceuticals, citing 2 of each, is a really good example to talk about here. So that question is clearly divided in 2. It said appraise basic skincare products and cosmeceuticals. Always look out for the word and. As such, you want to divide your answer 50-50 between basic skincare products and cosmeceuticals. That's your first division. Second division, it says that each example should cite at least 2 examples. That means that if you're going to cite 2 examples of skincare products and 2 examples of cosmeceuticals, you want to again subdivide those halves into quarters. So for your first quarter, you might talk about a basic skincare product. Maybe you'll talk about sun cream. Maybe you'll talk about moisturizers. Maybe you'll talk about basic anti-aging products. On the second, you want to make sure that you've got a quarter of your words for each of those products. Beyond that, you want to then, in your cosmeceuticals point, do the exact same thing. So whichever 2 cosmeceuticals you talk about, whether you're talking about retinoids, peptides, or antioxidants, you want to choose your 2 or 3 points and then divide your word count between them. If you do opt to go for 3 examples rather than 2 or more, again, just further subdivide your word count to make sure that there's equal weight given where it's needed. And then when it comes to counting your mark scoring points, you know that 5 marks are available for the cosmeceuticals and 5 marks are available for the skincare products. It's already told you that 2 examples are sufficient. So you know that those 5 marks must be divided in 2. So you're looking for 2.5 scoring points. Obviously, you can't have half a scoring point. So the safe thing to do is put 3 scoring points for each of the examples you make. The structure of the mark scheme actually gives you marks for giving examples of the types of cosmeceutical and skincare product, which is why the mark split divides unevenly. In this case, you can gain 2 marks for discussion of each example and 1 mark for citing the example. So if you were going to talk about sun protection factor and skin and sun care products, then you would have already gained a mark for saying 1 example of basic skincare products is some products containing sun protection factor or with some protection factor ratings. So going to talk about sun cream. There's your first mark. You could then start discussing the relative efficacy of sun protection factor. You could talk about how it's a really proven method of protecting, of preventing photo damage. You can talk about how it's got a long evidence body behind it. And then on the flip side, you could potentially talk about the fact that excessive use of sun care products tends to indicate an excessive exposure to sunlight as a general part of someone's lifestyle, so nonetheless maybe a cause of concern. So you've got a couple of points, 2 or 3 points for your example there, and you've counted those scoring points and you've blotted them down. Once you do the same for each of the other examples you're making, whether it be in skincare products or cosmeceuticals, you should have divided those 10 marks very evenly, giving you a good confidence that even if some of your mark scoring points are incorrect, you have a good amount of leeway within which to pass the question. Okie dokie. Sorry, I just scrolled through. So finally, you want to check the question marking carefully. This is really a repetition of the previous point. Once you have finished assigning your mark scoring points, check them through. and make sure that the marking is conducive to what you have produced. If you ever have queries about how you should be splitting your word count in a question, and for some of them where it includes clauses such as include in your answer a critical appraisal of X or Y, where it can be more difficult to know where to put your marks, feel free to always email a question through to us, and we will analyze the question text and let you know roughly how you should be splitting your marks. Okay, so to recap what I've gone through here, I've talked about the structure and breaking your answer down into subsections. So look out for keywords like and or include in your answer within the question paper. Also, long strings of nouns separated by commas, such as the question talking about skin folds, facial shape, facial symmetry, wrinkles. Each of those commaed off points is a subsection. So divide your answers according to the subsections and keep your prose brief. Furthermore, be explicit and clear with your mark scoring. Really make sure that you're tying each point to a subsection, i.e. you're talking about an element of the effectiveness of sun care products, and you're talking about that as part of your discussion of skincare products, rather than discussion of cosmeceuticals. Keep your simple facts on the table. Don't overlook information just because it seems simplistic. You'll see many examples of this in the problem questions, but make sure you go over things that seem self-evident. And finally, be rich on content with lots of points, but light on analysis. Divide your word count between the subsections of the question. Count those 10 mark scoring points at least. Always try to shoot over the 10 mark scoring points and include at least 12 or 13 in your answer, and then check that marking carefully. Okay, I'm going to hand over now to Dr. McGregor, who's going to talk about the 5 problem questions which I identified in the notes that you were provided with, which Emily helped me to analyze and pulled out the data behind, which is going to be running over continuity of care, combination treatments, and a variety of others. So I'm going to hand over to you now, Emily, and if you want any points from the notes, feel free to chime in.
Thank you, Ben. Thank you. Ben, you covered these questions really well in your booklet that you sent out, but I'll go through them again. At least the webinar gives you guys an opportunity to ask us questions directly. So when we were assessing the SAQ answers, as Ben said, some questions had a higher sort of failure than others. There were some places where people just had knowledge gaps, but there were other questions where clearly they were not the most difficult from a knowledge perspective, but overall were not answered particularly well in terms of scoring points. So the first one is 2F, and for those of you who don't have the questions in front of you, I'm just going to read the question out to you in full. Question is, continuity of care post-treatment is critical. Explain why this is the case and the measures required to support continuity of care. Include an explanation as to the role of doctor or other professionals in facilitating change. So if you just sort of looked at it at a glance, you might just start generically talking about continuity of care and what it is for a couple of hundred words. But really this question needs to be broken down. It's asking you a couple of things. So the first thing it says is explain why this is the case. So I'd rephrase that and say, why is continuity of care post-treatment critical? First thing I need to answer. And then also says, and the measures required to support continuity of care. So second question I need to answer is, what are the measures required to support continuity of care? So they're subtly different. And then the third thing I have to talk about is the role of doctor or other professionals in facilitating change. If the question mentions 2 things, I would definitely address them. So I'll talk about the doctor or practitioner and a range of other professionals just to sort of cover my bases. So in doing that, I split the question into 3 sections. And because of the way it's marked, as Ben had said earlier, you really can't afford to consistently miss out sections or miss questions within the questions that they're asking you. So we've split it into 3 sections. We've got 10 marks. So following Ben's advice, to be on the safe side, want about 4 points for each of those sections. So I'm going to talk about why continuity of care post-treatment is critical and try and get 4 mark scoring points there. And another common thread throughout this is they're looking for general principles, very general. So actually, you don't even need to know about aesthetics to really know why post-continuity of care is important when you're dealing with clients or patients. All of you can draw on your own experience and knowledge anyway. There are very, very few occasions where the MARC scheme is requiring you to give very specific, detailed or advanced knowledge of the actual procedures, unless it specifically asks you for examples, which it rarely does. So it's all generic stuff. So an example would be continuity of care post-treatment is critical to maintain a practitioner-client relationship or to safety net against complications. Simple, simple things that are exactly the same as your own clinical practice. So that was the first question. I think the reason people struggled was they didn't explain why and explain what measures there were to support it. They did one or the other. Okay. That would be that one. Or they only mentioned one other sort of generic point, like they could be referred on, rather than talking about for what other professionals could help in that scenario. So it could be a surgeon, it could be a psychiatrist, it could be a GP, it could be a colleague. That's just a couple of examples. At this point, I don't know any questions on that question before I move on. We can have some generic questions at the end. No? Okay. So the second question that people struggled with was 2H, which is regarding combination treatments. I'm going to read it out to you. A client has inquired about a combination dermal filler botulinum toxin treatment plan. Explain the necessity of initial client physical exam and critically evaluate the benefits and costs of the use of combination procedures within aesthetic medicine. The first thing it asks you to do is explain the necessity of initial client physical exam, which I actually missed out completely when I was answering this question. But it's really important. It's half the question. And the second half is critically evaluate the benefits and costs of the use of combination procedures. So you've got the two sections. Explaining the necessity of initial client physical exam. Again, you can be very generic. We're talking about a facial and skin assessment, but just generally, why is it important that you actually look at their face before you just inject wherever they've asked you to inject? So this is going back to someone coming in and saying, I'd like some lip filler, please. Why must you have a look at them, assess them? And you'll all know this. There'll be a range of things ranging to getting the right treatment for them, managing their expectations, being safe, being able to record in your notes that you've examined them appropriately. It's all sorts of generic points. And secondly, I just want to highlight one word here, which I think is a little bit mean, is they ask you to evaluate the benefits and costs. Costs, they're not talking financial, they're essentially talking about advantages, disadvantages here. So financial cost is one, could well be one implication, but cost, it's also talking about just cost to you, cost to the client or patient. So I'd put a line on, circle that word and maybe put risks or negatives, talking about pros and cons of combination procedures. And again, these are generic points that are not asking you to talk in depth about any combination procedure. I mean, there are lots of combinations you could mention, you can do marionette filler and treat your DAOs with botulinum toxin at the same time. You can do Botox and filler in the perioral area. There's all sorts of things, but those, again, we're not testing whether you can do the most advanced injection techniques and no in-depth. We're talking about general principles again. So, for example, a general principle, let's say a benefit might be that the two together might enhance the longevity. It might be more convenient for the client to get both treatments done in one setting. Disadvantage might be that the botulinum toxin and the filler have slightly different risks, so there'll be double the risk, double the cost. Okay, that's 2H. 4D is our next one. This one, I think we can give you a sort of as much help as possible here, because really this question shouldn't be too difficult. It says, citing at least 2 examples, explain how tools can be used in support of a skin health assessment. And you could answer that in a very generic way, because there's all sorts of tools that can be used, but really they want you to talk in depth about 2 tools, the 2 tools that we mentioned most in the e-learning, which are in most common practice, which are the Glogau scale and the Fitzpatrick scale. You can talk about others, but I would talk about at least those 2. And when you're talking about them, I would encourage you to write about them as if you're writing to someone who has no idea who has never heard of them before. What on earth is it? Really basic, really, really, really basic. So what is it? What does the scale look like? What do I do with it? How does that help you as a practitioner? How might that help the patient? Really simple stuff. And it's just asking you to explain what they are and how they're used. It's not asking you to analyse them or compare them or talk about well, anything else really. It's quite, again, it's just a knowledge question. But I would definitely talk about Glogau and Fitzpatrick, and you may talk about others. There is some discretion, so the examiners, if they see that you've talked about something that has not come up on the mark scheme but is entirely appropriate, they may be able to give you marks for it. But I wouldn't consistently rely on that. I would try and get, what the question is asking you as specifically and concisely as possible. And then if you have some words left, by all means, talk about other things that you think are relevant or that backs up your point. But I wouldn't go off on any tangents. And certainly there's no real space or marks available for your opinion. It's mostly just looking for your knowledge. Okay, I think you'll be fine with that one as long as you mention those two tools. Some people just talked about skin tools generically and really didn't go into any depth with any examples and didn't talk about those two that I've just mentioned, and they'd struggle to pass that question if that was the case. So 5S, oh, this one looks so easy. With regards to botulinum toxin use, critically compare static and dynamic wrinkling. Very simple, but was actually quite hard to pass. So you've got two sections, haven't you? You're talking about static wrinkles and dynamic wrinkles. And for both of them, you're relating that back to how you would treat or would not treat with botulinum toxin, how botulinum toxin might work on static wrinkles or might work on dynamic wrinkles. And again, imagine you are talking to someone who has never heard of static and dynamic wrinkles before, doesn't know how botulinum toxin works. It's really basic. Imagine you're explaining it to a patient or a client, okay? In which case, if you're talking about, let's say, static wrinkles, what are they? How are they formed? How do they respond to botulinum toxin? Do they respond well to botulinum toxin? You need to squeeze out 5 marks talking about static wrinkles and 5 marks talking about dynamic wrinkles. So it will sound a little common sense, a little dull, a little bit like primary school question answering. But for this one in particular, which we may try and alter in future sessions, we just want to know that you know the basics. And it is an important question because you'll be explaining this to your patients again and again and again and again when you're trying to manage their expectations, okay? We're not looking for anything complicated, we're just looking for you to be thorough. Okay, last one, 70. With reference to dermal fillers, contrast their use without local anaesthetic. I think the main problem here is people thought that was topical anaesthetic. And we were talking about local anaesthetic that is integral within the filler. So the majority of fillers have a small amount of lidocaine in them. It's possible to buy them without lidocaine in them. Okay, there's a very small price difference, but the sort of default would be the filler with a small amount of lidocaine. And it's asking you to talk about essentially the advantages and disadvantages. Often when it's saying contrast their use, it's about advantages and disadvantages. So again, you're splitting it into 2 halves. You've probably got 5 marks for each. And I would encourage you to think about the advantages to you, the practitioner, and the advantages to the patient, and the disadvantages of each. So let's say you've got a filler with some lidocaine in it. There are some advantages to you, okay? For example, it's easy to get hold of. You know, if your patient's comfortable, it makes it easier for you to treat them. There may be some disadvantages to you, the practitioner. It's more expensive, okay? And then there may be some advantages and disadvantages to the patient. For example, might slightly increase the risk of allergy, because not only could they be allergic to the filler, the hyaluronic acid filler, they could be allergic to lidocaine. And then there's some obvious advantages to the patient, it's more comfortable. So try and think about you, the practitioner, and the patient, and advantages and disadvantages for both products, one with, one without, and you will be able to formulate at least 10 points. Whereas if you just glanced at the question, you might not, and didn't break it down in that way, you might miss a few points, which again are fairly obvious, and we just need to tease them all out. Okay, they're the 5 questions that people struggled with. There are others here and there, and occasionally it was knowledge, but often it was due to the way they were answered. I just want to make a couple of generic points. Ben's probably made most of them, but beware of going off on tangents. If you're going into lots and lots of detail, you probably don't need to. And also, we do encourage you to read academic papers and to reference anything that you've quoted directly. But again, to get these knowledge points out, you don't need to discuss journal articles in depth. You can reference something if you make a point, a factual point. For example, let's say you're talking about the morphology of aging. You're talking about, I don't know, that you get bony resorption at the maxilla when you age. You could reference a study if you read that in a study, but you don't need to start comparing results or analysis from various randomized controlled trials, etc. It's not, we don't, no literature reviews in there, please. It's just going to be a waste of your time. The second one is, again, Ben has mentioned it, but it's something that wasn't immediately apparent to me when I answered these questions, is that the questions don't flow on from each other. So let's say in 3A, you made a point about, I don't know, client, patient, practitioner relationship or continuity of care. If that is relevant in, I don't know, 7B or some other question later down the line, you can completely restate it. I would take each question as completely individual, okay? Like a quiz, not a dissertation or anything like that. And I think that is about it. But always go back to general principles before you go into any specifics. There's very, very, very little information about, for example, injection technique or how you in detail actually do the procedures. It's all principles. And that's it. So whilst we want it to be coherent, there aren't lots and lots of marks awarded for, how beautifully written it is or how it flows, as long as it's clear and it hasn't got terrible sort of grammatical or spelling disasters, then that's not the focus of it. It's not an essay, so don't worry about that too much. And if there's anything that you really don't understand, ask us and we'll do what we can to give you the information we need. Obviously, we have limitations on what we know and about what we can tell you. I think that's it.
Emily?
No problem. Ben, you've gone very faint.
Oh, am I coming through better now?
That's a bit better, yeah.
There we go, yeah. It just takes a little while to adjust. Okay.
Hey, any questions? Throwing them our way. Oh, Ben, you're just rounding up before we do that.
Yeah, I think I'll. If anyone does have any questions that they want to put to Emily or myself, now's a good time to pipe up.
Can I ask you both about the bibliography?
Yeah, of course.
So I know that you said that we don't need to use external sources, but I was really just looking at your mail that you sent out yesterday, and I'm just curious, because it seems to be suggesting that perhaps there are some questions that we should be using external sources for. Did you find that the examiners, that was a feeling from the examiners, that there are some questions that we do need a bit more information for than what we have in the e-learning modules?
Of course, it's absolutely been a difficult point to come to a core conclusion on. The issue is that the vast majority of these questions, where they're talking about explaining or describing, for instance, let's say question 2A, explain the treatment implications of the following condition: diabetes, autoimmune disease, immunocompromised patients. In a question like that, the e-learning is more than sufficient, and you don't need to be citing, because you're not drawing on specific bits of facts and figures. You're just drawing on your general learning. However, in question 1C, you are asked, consumer demand for aesthetic treatments is rapidly increasing. Analyze key historical events which have popularized aesthetic medicine and the growth-related impact upon economic valuation. So it's a two-part question, one half about the history, about the historical events, and the second part about economic valuations. When you're talking about economic valuations, to score the maximum marks in this question, you would need to include an estimation of how much the medical the aesthetic medical subspecialty is worth, how much the industry is worth, and to what degree it is growing or shrinking. If you were to provide figures for this, those figures need to come from somewhere, and if you take a figure from an external website, at that point you do need to cite, because you are drawing a specific piece of evidence from an external source, and it would be plagiaristic not to do so. However, in the general course of most of the questions, when you're simply explaining knowledge, you won't need to be referenced.
You could theoretically do, I don't know, I think I probably did about 3 references in my entire SAQs, but I did know the e-learning inside out. So it's possible, but sometimes if you're making a point, it's just easier to, and you've got it from somewhere specific, then you will have to mention it. But what we don't want is you going into massive details talking about a particular course.
Yeah, I think that's a good point that Emily raises there, which is that there's a distinction between referencing and deeply discussing references, which is never required, and citing a piece of information you use. You do need to cite any direct figures or facts that you get from anywhere external because of the plagiarism and how that works, but you don't need to do any deep source analysis.
Okay. I don't know if anybody else wants to ask a question. I do have another one.
Mm-hmm.
Feel free.
Go ahead.
I'm sorry if you've asked this before, because I was thrown off the e-learning for about 15 minutes. So forgive me if it's a repetition. But looking at some of the questions, when you look at the subsets, for example, the question that asks about, what is the anatomy that you would encounter when doing an upper face treatment for Botox? Yep. Yep. And then there's a similar question for dermal fillers that says, what anatomy would you encounter for the mid and lower face treatment with dermal fillers? Yep. And when you look at the actual subset of questions, it says, for example, for the Botox, it says, describe the vessels and describe the muscles and describe the nerves that you would encounter with a Botox treatment, which is a much larger question than the original question, if you see what I'm saying. The original question just said to limit to the upper 1/3. But when you look at the subsections, it seems to be saying, what are all of these vessels, muscles, and nerves that you can encounter?
Of course, I can see how that can be confusing. So the text of the question here is explain the anatomy of relevance to an upper face treatment with botulinum toxin, full stop. So that's your introductory statement. Include muscles, vessels, and nerves in your answer. So the question that you're answering is which parts of the anatomy are relevant to toxin treatments. You don't need to analyze them in any depth. You simply need to be listing relevant parts of the upper face and their relation to botulinum toxin treatments. And then you want to divide your answer 3 ways between muscles, vessels, and nerves. So you'll talk about 100 to 150 words on each of those, and you will just discuss 3 to 5 muscles, or 3 to 5 vessels, or 3 to 5 nerves, and their relevance to toxin.
And just keeping all the upper face.
Yeah, the question is talking about upper face treatment, and then it's just telling you what to include within that. Okay?
Yes, that's fine.
Fantastic.
Yeah, that's perfect.
Did anyone else have any other questions?
Can I ask a question?
You certainly can.
So this might seem like a really silly question, but
no, not at all.
5E, the second part of question.
Yes, what the internally facing versus externally facing job roles.
I don't know if I'm over-analysing this. I really struggled, and I thought, does this simply mean client-facing versus non-client-facing? That kind of thing.
It's exactly that.
Okay, fine.
So let's say internally facing might be someone who works from home, and at the extreme, externally facing might be someone on the TV.
Gotcha.
So does that make sense?
Yeah, it does. I think I was over.
Yeah. It's a very sort of formal way of saying, talking about how much their occupational history might be important, and generally occupational history is important regarding, for example, risks or adverse effects. If lots of people are going to see them, or if they're high profile, or if their face is very important to their job. And a TV actress very important. Someone else might not be.
Yeah. Okay. Thank you.
Okay. Does anyone have any final questions? Okay, I'm going to provide another little slot for Q&A in a moment, but for now I'd just like to wrap up some of the things we've talked about. So I'm going to talk about mistakes here that people can make. So the core mistakes that we've discussed are misreading questions. It's really important to get that text down, and I'm going to go through an example with question 7a in a second. Failing to score repeat marks. When we talked about the relationship between youth and attractiveness in terms of facial shape, facial symmetry, etc., you need to be talking about your scoring marks for each subsection. You might need to be discussing the culture dependency of eyebrow shape in relation to youth and attractiveness, and then the culture dependency of facial symmetry in relation. You need to make it every time. And finally, missing the obvious with the equipping a clinic for aesthetic treatments. You need to talk about the basics: safe, sterile, properly staffed. Now I'm going to go back to misreading questions here, and I'm going to talk about question 7a. I'm just going to run you through my analysis of the question text to give you an example of how to proceed. So the question asks you to explain the mechanism of action. Explain the mechanism of action of stimulatory fillers and the biochemistry and pharmacology of dermal fillers, semi-permanent dermal fillers, and temporary dermal fillers. Drawing upon this information, critically contrast both the biochemistry and pharmacology of stimulatory and replacement dermal fillers. The use of a table is permissible in the answering of this question. That is the most difficultly constructed question in the set. It's very tricky to pull it out, so I'm going to break it down for you. We're just going to read along, and whenever we're asked to do something, we're going to set it aside. So, explain the mechanism of action of stimulatory fillers. First, that's it. Explaining the mechanism of action of stimulatory fillers is our first part. And the biochemistry and pharmacology of, okay, so now we're going to be asked to do both biochemistry and pharmacology for a series of things: permanent dermal fillers, permanent dermal fillers, and temporary dermal fillers. So we've got our next 3 points, which is permanent fillers, semi-permanent fillers, and temporary fillers. We're going to set those 3 out, and then for each of them, we're going to discuss both the biochemistry, i.e. what it's made up of, and the pharmacology, which in relation to dermal fillers, I realize the term pharmacology can be confusing, but in this case, it's talking about the duration of effect and the method of delivery of the filler. So you're talking about really basic stuff, because it's only, you're splitting your answer down into a lot of small parts for permanent fillers, semi-permanent fillers, and temporary fillers. So we've now got 4 core parts of the question: mechanism of action, and then the 3 types of fillers. Finally, drawing upon this information, critically contrast both the biochemistry and pharmacology of stimulatory and replacement dermal fillers. That's a separate subsection which is asking you to contrast stimulatory and replacement dermal fillers. So the final 5th of the question is going to be a contrast, which is obviously going to have its own breakdowns into both stimulatory and replacement fillers. So writing out the question in these segments allows you to break down how you're going to be answering things, and it will become how are you going to be answering things. And it's going to become obvious based on that you are going to repeat yourself at some point. You are going to inevitably, in your discussion of the biochemistry and pharmacology of permanent, semi-permanent, and temporary fillers, you are going to make points that will then be repeated when you contrast the biochemistry and pharmacology of stimulatory and replacement fillers. That repetition is fine as long as you break it down into the subsections of the question. However, say you did a great explanation of pharmacology of the 3 kinds of fillers, and you did a great contrast of both the biochem and pharmacology of stimulatory fillers, but at the start of the question, you forgot to explain the mechanism of action of stimulatory fillers as its own specific thing, you could risk losing the question simply because you omitted out that tiny little bit. So read through your questions and break them down into their constituent chunks. I believe that that's everything. So I'm going to pass back over for any final questions that anyone might have. You can also bring up specific SAQs if you'd like to.
Hello.
Hi.
Yeah. Can you just, there is a question 3C. Well, I'm not understanding this, how to split this, that is, explain the pathways for providing client-centered psychological and emotional support, including strategies aimed at managing unmet expectation and post-decisional regret. So how to split this one? I'm thinking, is it like taking about psychological part and emotional part?
It's a great example. Okay, so I'm going to run through this one backwards because I think it's easier to do in terms of the structures, because it ends with a very simple little part, which is within this answer, so it's an obvious division, an explanation as to the professional boundaries to be provided. So our first part can be that professional boundary setting. Now, the next part is explain the pathways for providing client-centered psychological and emotional support. So we're looking for what pathways is asking us to explain, including strategies aimed at unmet expectations and post-decisional regret. I agree that this one is a little clumsy in how it's structured. I would break it down probably into parts, I would suggest here, based on my experience with the question. So first off, we are going to talk about pathways for psychological and emotional support. So we have been asked for, we haven't been asked for it specifically here, but you should infer from the question that when we're explaining the pathways for emotional support, that could be before or after the treatment. So you can start off by breaking down a section of your question where you're going to talk about pathways, and you can discuss pre-treatment pathways and post-treatment pathways. Now, these pathways can, referring back to our previous point of not missing the obvious, can be really simple. An example of a perfectly valid pre-treatment pathway for the psychological support of your patients is simply your practitioner-client consultation with them. I realize that seems like the most obvious thing to say, but a simple consultation is in itself a pathway for psychological and emotional support, because you will be providing a bulk of support to the person. Moving on past that explanation of pathways, so that's the question, we're going to move on to the next part, which is the psychological strategies to manage post-operative unmet expectation. So you've got that division that's a little tricky to set, but you can see that there's the explain pathways for providing client-centered psychological and emotional support, and then including, so the including is our division, strategies aimed at managing unmet expectations and post. So our second part is this including strategies. So we can talk about strategies such as, again, repetition, but you could talk about the consultation once more and how that can be important post-treatment. But you can talk about other stuff. You can talk about using before and after photographs to give people objective evidence. You can talk about decision-making, referring to their aftercare plan and how shared decision-making can assist minimizing the problems from unmet expectations. So that's our second big chunk of the question we've gone on to. We're also going to need to talk about psychological strategies and post-decisional regret, because it's asked us to talk about both unmet expectations and, the keyword there being, and post-decisional regret. So when we're talking about post-decisional regret, it's probably going to be a lot of the stuff that can manage unmet expectations, because it's the same kind of area. If someone's expectations aren't met, if they've got regret after the treatment, you can discuss what their reversal options are, or you can discuss referring them on to another clinician. Or again, you can come back to the client consultation, you can come back to shared decision making, you can come back to your basics. So you've now got these three first elements of the question: the pathways for psychological and emotional support, the psychological strategies for managing unmet expectations, and the psychological strategies for managing regret. Finally, we need to include our explanation of the importance of professional boundary setting. So we need to talk about why it's important to respect professional boundaries and why to set them. You know, obviously it helps you adhere to the law, but additionally, it helps you promote your own impartiality and independence. So you've got these four sections. So we've got these four split down sections. So you'd want to divide your marks equally between the four parts, going for, again, 3 or 4 points for each of these.
Thank you.
No worries. Apologies, that one. I've got an awful cough all of a sudden.
Oh, about to speak.
I'll mute my mic for a moment.
Continue.
There we go. Okie dokie. So we've talked about how a particularly thorny question like 3C can be broken down by watching for words like including within this answer and can be a very powerful word in these questions. So are there any other questions that anyone wants to discuss? We've got about 5 minutes left if we need. Okay, everybody seems to be happy, which is fantastic. So again, to recap everything we've learned today, it's really important that you respect these subsections and read for them, divide your answers accordingly, and keep your prose brief, but don't answer everything in bullet points. The style that you're going for is very clear, very explicit. It relates to subsections, and it's got lots of simple facts, self-evident information to build upon. It's got rich content mark scoring points. So rich on content, and it's light on deeper analysis. You've divided your word count between different parts, and you are counting your mark scoring points and dividing them equally between them. Always overcompensating, including a couple extra mark scoring points just for safety if you can. Finally, you're checking that question marking, and in terms of your mistakes, you're making sure that you're not misreading the question. You are repeating your mark scoring points if they apply to multiple different subsections, and you're making sure you're not missing the obvious. If you follow all of these steps, I think it will give you a significantly boosted chance of success in the SAQs based on the feedback that we've received thus far. So thanks so much for joining us tonight. There will be a recording available this after, so if any of you have technical difficulties, feel free to look out for the email with that link. And if you have further written questions, don't hesitate to get in touch. Thanks very much, Gregor, for joining us.
Thank you.
Okie dokie. Thanks very much, everybody. Get in touch via email if you have any concerns. We'll see you all again soon. Thanks very much. Bye.
Bye.